بسم الله الرحمن الرحيم. الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. اللهم انفعني بما علمتني وعلمني بما ينفعني وزدني علما إنك العليم الحكيم. My topic today, I will present here 3 signs of musculoskeletal regions and discuss these signs and what is the indicative diagnosis for each sign. The first sign is absent bow tie sign, and this will give the diagnosis of bucket handle tear of the menisci. Here we see multiple T1 weighted sagittal images, and we see soft tissue intensity between the anterior and the posterior meniscus, and there is loss of the normal bow tie appearance of the meniscus in this region, and we call this sign absent bow tie sign, and this is a good sign for bucket handle tear of the meniscus. The absence of normal bow tie is secondary to displaced fragment, which makes the handle of the bucket and also mandate the normal. We should see absent bow tie in at least in 2 adjacent sagittal images with a normal meniscus body segment appearance is not present. So absent bow tie sign indicative of bucket handle tear of the menisci. Normally we should see the at least in 2 adjacent slices. If there is no bow tie in adjacent 2 slices, sagittal slices, this means absent bow tie sign and indicative of bucket handle tear of the meniscus. The second sign is double posterior cruciate ligament sign. Also, this indicates a bucket handle tear of the meniscus, and usually it is involved the medial meniscus in about 80% of cases, and these meniscus flip medially and to come lie anterior and inferior to the posterior cruciate ligament, mimicking a second smaller posterior cruciate ligament. And we see it in the intercondyle notch, and this represents a fragment of torn meniscus which appear low signal intensity oriented band lying and parallel to the posterior cruciate ligament, creating double posterior cruciate ligament sign. The third sign, we call it bow tie sign, and this indicates the discoid meniscus. Normally, we see the two contiguous sagittal slices, the bow tie appearance. If we see the bow tie appearance more than three sagittal slices adjacent to each other with 5 mm thickness of each slice, this indicates the continuity of the meniscus between the anterior and the posterior horn, indicating discoid meniscus. Thank you for listening. Hoping to see you in another talk.